Hi everyone, welcome back. Today we're going to be talking about laser resurfacing. Let's get started. So laser resurfacing is a broad arching category that talks about a lot of different lasers. Let's get into the nitty-gritty details so you understand what is the best treatment for you and what to expect throughout the recovery process so you can be prepared for your upcoming appointment and treatment. So laser resurfacing is a broad arching category, and lasers come in all shapes and sizes, and it's really important to understand that. So not every laser treats and affects the same desire or the same concern that you may have. So it's really important to understand that there are different lasers that treat different conditions. And laser resurfacing typically treats the top layer of the skin to help with fine lines, wrinkles, textural issues, sometimes pigmentation, and several other things. And this category of lasers is very effective and very helpful, but you have to be very cautious depending on your skin tone, your skin quality, how aggressive the treatment is, and there's a lot of different nuances to these treatments. So it's really important to make sure that you see someone that is a professional that understands these nuances, understands your concerns, and understands what is the best treatment for you. It's not a one size fits all. So today specifically, I want to talk about a CO2 laser, which is the gold standard for skin laser resurfacing that helps with really all of those textural issues, fine lines, wrinkles, some of the pigmentation, and really helps to kind of give you a fresh new start for your skin. So this procedure can be done both in the office or in the operating room. If I'm doing in the operating room, it's typically with other facial rejuvenation procedures like a blepharoplasty, a lower blepharoplasty, or an upper blepharoplasty, or eyelid lift, a facelift, a neck lift, those types of procedures to kind of as an add-on to further improve the top layer while I'm also working on the bottom layer. Additionally, if that's not necessarily something that you're interested in, we can just do these treatments here in the office, and it's actually very well tolerated. So let's talk about the specifics of how to prepare and what to expect during this procedure. So if we're treating it in the office, one of the most important components to make sure that you're comfortable during this process is the numbing in the numbing process. This takes time, and it's an investment for both myself and your time to make sure that you're comfortable and you experience this with as much comfort as possible. Again, I use comfort a lot because it's really important, because if we're not making sure that you're comfortable, then it's not a very fun experience for you. So I use topical numbing medicine, and I let that sit for at least half an hour to an hour, depending on how things are going. I oftentimes will use nerve blocks, which help to kind of make sure that the majority of your face is numb so that when these treatments occur, you're not really feeling it. The other thing I do is I also give you some medication to kind of relax you and take some of the pain off in preparation for the treatment. So those three things together really are very helpful to make sure that you're comfortable throughout the procedure. The CO2 laser has a lot of different settings, which allows us to ultimately treat very aggressively or very modestly. And I think that's really important for you to understand. So if your goals are kind of a one and done type of treatment, then you will expect a longer recovery process. It's really important to understand that you're going to have more downtime, more swelling, more stuff that you have to ultimately work through to be able to get you the best result. There are options to take a less aggressive approach with less energy, more treatments to ultimately get you to your goal, but understanding that it takes multiple treatments, a little bit less downtime, and more of an investment to get you to your desired outcome. This procedure takes about anywhere from about 15 minutes all the way up to about 30 minutes to 45 minutes, depending on how much we're treating. We can treat specific areas like the under eyes or just around the eyes, and that probably takes only 15 minutes or so. If we're looking at treating your full face, your neck, and your chest, then that can take a little while longer. So just kind of ultimately prepare yourself. Now let's talk about the recovery. So the recovery process can vary, and I'll say if you're having a more gentle treatment that requires multiple sessions, then your downtime will probably be anywhere from 3 to 7 days, depending on how you're recovering and how much energy and how well your skin is affected by this. If you're undergoing a little bit more of aggressive treatment, then I'd say 7 to 10 days is the typical downtime that you can expect after this procedure. So understand that there is some downtime, and that's why we call laser season the winter months, the fall, spring, and winter months, so that you're out of the sun and you kind of have shorter days and you have the opportunity to have more downtime. So like I had mentioned, you will expect to at least do quite a bit of aftercare just to make sure that your skin heals really well. The biggest thing to make sure that your skin heals well after these treatments is keeping the skin hydrated and moist during the recovery process. The most important thing is that that skin and that top layer is really well hydrated so that the baby skin, the new skin that's regenerated and the collagen that's produced is able to produce in a healthy environment with no chance of infection, no chance of scabbing, no chance of any other issues happening. And that could lead to ultimately bad outcomes. So Aquaphor is definitely going to be your best friend throughout this process. And it's really important to make sure that you apply as much as you possibly can and keeping your skin really hydrated. The other thing that I really like to do is vinegar solutions can be very helpful. So a 50-50 mixture of vinegar and water, and you soak some gauze in there and you can apply that to your skin. That's antimicrobial, which gets rid of all the bacteria, and also is just very comforting and soothing that you can do multiple times throughout the day. So we'll walk you through the entire process, when to start introducing other skincare products like vitamin C and your sunscreens and all these other types of things. But the first week, it's going to be very closely monitored. I'll make sure I stay in touch with you throughout the entire process and make sure that you get the best outcome. So the single most important thing when it comes to this is when you've decided to make the commitment and undergo a laser treatment like a CO2 laser, it's extremely important to make sure that you maintain your investment. If you go back out into the sun, not wear sunscreen, or just really, don't have a good skincare routine, then ultimately your investment will go right into the drain. And we do not want that. You're spending good money, good time, investing your recovery time, staying away from, friends and family and things like that as you recover. We got to make sure that you maintain your investment. So good skincare, chemical peels, really effective, good sunscreen is extremely important. And we will make sure that you have all of those products in preparation so you can get the best possible result. So lots of information, and there's much more that we can talk about. So if you have any other questions, leave them in the comments, give our office a call, and I look forward to seeing you guys soon.